Mandy? Hi Mandy, my name is Justin Melbourne. I'm a HSC student nurse. I'm going to be completing your physical exam today, okay?
Okay.
Okay. Can you have a seat for me?
Sure.
Okay. I'm going to perform wipes. So I'm going to wash my hands. I already identified myself. I've got privacy set with the door shut. I explained what I was going to be doing, and she's safely sitting on the table here. Okay. Then going to identify my patient. Mandy, can you tell me your full name?
Mandy Robitaille,
Great. What is your date of birth?
January 11th, 1982.
Great, I've got my 2 identifiers. Also, do you know where you are today?
I'm at Holyoke Community College.
Fantastic. And do you know the date today?
November 26, 2013.
Fantastic. Okay, so when I was walking in with her, I assessed how she was dressed. She was looking great. She's well groomed. I also was able to assess her gait, where she was walking without any restrictions. And she's alert and oriented ×3. She's answering my questions, so she's cognitive. Mandy, were you able to complete the health questionnaire out front?
I was, yes.
Okay, so she was able to read, she was able to make decisions on her own. Her eyes look like they are spontaneous, they're opening and closing on their own. She's got very good behavior, she's sitting here, she's answering my questions. Her face is looking symmetrical to me. I'm able to just assess it and look and make sure that the eyes are equal, the ears are looking equal. Visually, everything's looking symmetrical. Okay. Mandy, I'm also going to check your reflexes, okay?
Okay.
Okay. So when you check reflexes, you use both sides symmetrically. Okay. I'm also going to check your vitals today, okay? Check the blood pressure. I'm also going to check a pulse. Going to check her temperature. And while I was checking her pulse, I was also able to count respirations. Her respirations were 20. Her blood pressure was 120/80. Her pulse was 80. Her temperature was 98.6, and out in triage we were able to check her height and her weight, which her BMI score came back positive and within range. Okay, I'm also going to now check her head. So I'm going to check her scalp, make sure it's clean, free of lesions, rashes, abrasions. Going to check her eyes, make sure there's no discharge. Going to make sure that they're equal and reactive to light, so pearl. Okay. Going to check her hearing out. Can you hear this for me?
Yep.
Okay. Check the other side.
Yep.
Great. How's your nose today? Are you able to smell everything?
Yep.
Great. Can you open your mouth? Okay. Her mouth is moist. Her teeth are intact. Everything is symmetrical up here. I'm then going to check her neck. And it looks like her trachea is in place. Her JVD, she has no JVD. And I'm also going to check her temporal pulse and her carotid pulse. Okay. And do you have any pain today?
No.
No. Okay. Mandy, are those prescription glasses?
They are. Yes,
Okay.
I'm nearsighted.
Thank you for allowing right?
No.
Okay, do you have any known drug allergies?
Nope.
Do you have any allergies?
Not at all.
Okay. Are you currently using any drugs or alcohol?
Nope.
Okay. So Mandy, now I'm going to check your chest and lung sounds, okay?
Okay.
Okay. So I'm going to check second intercostal space for aortic, pulmonic, second intercostal space. Third intercostal space is Erb's place for S1, S2. Bilaterally, I can hear the love dub. Going to then check tricuspid. Midclavicular line, I'm going to go for the mitral, which is also the apical. And I'm going to check the apical pulse for a full minute. And I would normally check that for a full minute. I'm now going to check your lung sounds.
Okay.
So I'll first start above the clavicle. Okay. Breathe in. Okay, I'm going to go in an H pattern. Good. Good. Off to the side. Okay, and then if you just turn for me. Great. Okay. And can you take a deep breath for me? Okay. Chest is symmetrical. It's able to move out symmetrically. Okay, you can have a seat. You can have a seat. I'll also check the lower lobe. Great. Okay. Now we're going to check your capillary refill. If you could just flip over your hands for me. Okay, cap refill is less than 3 seconds. On both hands, I'm going to check skin turgor. There's no tenting. Okay. Can you feel my fingers?
Mm-hmm.
Okay. Can you tell me which finger I'm touching right now?
My ring finger.
Okay. And how about now?
My index finger.
Great. I'm going to check your brachial pulses bilaterally. Okay. Okay. Radial. Okay. Okay. Feels like your skin is warm to the touch. It's pink. You're not dry.
Nope.
Okay. Okay. So your breath sounds were clear.
Good.
Are you having any shortness of breath?
No.
Okay. We're going to check your pulse ox. If you could put your finger into here, it's going to give you your oxygen saturation. Okay, so you're not coughing, no shortness of breath. At this point, it looks like her oxygen level is 100%, which is perfect. Normally, my patient would be in a gown or a Johnny. I'd be able to assess her skin for any lesions, any pressure points, any rashes. If she had any questions about a certain part of her skin, I would be able to check that out for her. Let's see. Next, we'll get into the nutrition portion. What do you eat on a day-to-day basis?
Well, I try to eat good. I have cereal and fruit in the morning.
a sandwich for lunch with some potato chips and like a square dinner with meat and potatoes and
Very good.
vegetables.
And these are your own teeth, as I was able to see before when I first inspected your mouth. Do you have any nausea or vomiting?
No.
Okay. I already noticed that your mouth is very moist, so you're able to digest your food a little bit easier. How is your intake of juices, water, milk? Are you able to ingest everything great?
Yeah, I try to get like six glasses of whatever.
6 is fantastic. And how about your outtake? Are you able to urinate quite often? Okay. Roughly how many times a day do you urinate?
Probably 4 or 5.
4 or 5? Can you describe it a little bit to me? Like the color? Is there any odor?
No, there's no odor. It's usually yellow
Okay.
and clear.
Great. Okay. So earlier we assessed your BMI, your height, and your weight. Do you normally exercise?
I try to exercise at least 3 times a week.
That's a very good one too. Okay. Do you have any diabetes, or do you have any diabetes in your family?
No.
Okay. So you're not, you don't have a high blood sugar or a low blood sugar?
No.
Okay. Are you currently taking any medications?
No.
Okay, no medications. So she had blood work done prior to coming in for this appointment. Checked her hemoglobin, and her glucose level was it was 80. So within that range of 70 to 100 is perfect. Okay, so now we're going to do your abdominal exam, but I first want to ask you, when was your last bowel movement?
It was yesterday.
It was yesterday? Okay. And you didn't have any problems with your bowel movement?
No.
Everything was in order? It was had texture to it?
Yep.
Great. No funny colors?
No. It was
Great.
brown.
Fantastic. Okay, could you lie down for me and just expose your abdomen? Okay. So first I'm going to inspect her abdomen, make sure there's no distension. Then I'm going to also auscultate. I'm going to go in a clockwise formation, starting with the lower abdomen. I'm going to listen for any bowel sounds. Okay, there's bowel sounds in all 4 quadrants. Then I'm going to palpate. Sorry, my hands are so cold. Okay. All 4 quadrants are soft. Any tenderness?
Nope.
Okay. You can sit back up for me. Actually, wait, before you sit up, I'm also going to check your femoral pulse.
Okay.
Okay, so bilaterally, I'm going to check the femoral pulse. Pulses are present. Then I'm going to check the popliteal. Pulses are present. Posttibular present. And pedal pulses are also both present. Can you feel my fingers?
I am.
Okay. Which toes am I grabbing?
My big toes.
Great. Okay, you can sit back up for me. Can you move your arms up like this? Okay. Your range of motion is great. Are any of your joints achy? Do you have any muscle pain?
No.
Okay. So I was able to assess that you were able to get up onto here, so your coordination is great. Can you stand up for me? Okay, can you turn this way? Okay, can you touch your toes? Then check your spine. Great. Spine is in order, and your balance is great. You can stand back up, and you can have a seat. Okay, I'm going to ask you a few questions in regards to your sexual activity, okay? Do you have sex?
Yes.
Okay. Have you ever had any pregnancies?
No.
Okay. Have you ever had the HPV vaccine?
No, it came out after I was too old for it.
Great. Okay. And do you use contraceptives?
I do.
Okay. And do you normally do your own breast exam?
Yes.
Okay. Great. Thank you.